Assalamualaikum warahmatullahi wabarakatuh. Thank you to Dr. FAUZIAH binti Abdul Wahid as our lecturer for Information Services and Facilities subject. We are from Group TQC4 and Group 4. Today, we would like to present about who is affected by COVID-19 in Malaysia. First, I will pass it to our first presenter, which is Addina Arisa binti Omar.
My name is Addina Arisa binti Omar. My matric number 1182777. The introduction for our topic is on 18 March 2020, a nationwide movement control order was declared aimed at controlling the epidemic. The virus that is destroying the world affects almost every country. Not only is the country economy failed, but this COVID-19 issue is also having an impact on society. It is the subtopic which is student, parent, worker, frontliner, and pregnant women. I will go through with the subtopic which is student. My first point is online learning. The World Health Organization has recommended to the general public and educational institutions to stop all activities. Online learning is currently assisting students to overcome the problem of learning without face-to-face interaction. Learning over e-learning has both advantage and disadvantage. The advantage is ability to study at any time or although from any location without readers for space or time limit, while the disadvantage is heavily reliant on the internet. Because both teacher and student must have very excellent internet network. If it is not good enough, access will be difficult. Second, inability to purchase a gadget. This problem is frequently related to low-income households because of there are siblings who also participate in the online learning process. Students must be disciplined when studying through e-learning. If not, the student will be difficult. Next, the structure of an online class might cause anxiety among students. Factors that may make them anxiety: first, feel heightened anxiety about keeping up to date with their schoolwork, assignment, or examination. Second, they struggle to concentrate or stay focused at home. This is because it might be related to environment or financial factors. According to psychologists and medical specialists, the majority of students who seek assistance at university counseling facility due to persistent anxiety. My last point for students is mental health. In Malaysia, there has been little research on the effect of COVID-19 on mental health, and most of them have been done on students. This is because looking at a screen for an extended period can cause arthritis, back pain, headache, and obesity. From there, their mental health are suffered greatly from having to complete a large number of tasks, assignments, and examinations. I want to highlight that good mental health is important for students to be able to continue learning even when they are not in school and must adapt to the new normal. Thank you, and I will pass to the next presenter, which is NAZIFA ZAINI.
Number 1182649. Second subtopic is parents. First, divorce. The COVID-19 pandemic endangers adults' overall stress. Adults may suffer dread and anxiety as a result of the pandemic, as well as significant disruption in their family and professional life, as well as increased caring and financial responsibilities, all of which may add to the stress. Divorced and separated parents may be more vulnerable to stress during the pandemic owing to interconnected legal, financial, and parenting issues. During COVID-19, such challenges may be exacerbated as divorced parents deal with job loss and financial hardship, navigate altered custody arrangement in the face of public health traits and attempt to develop common norms for viral risk reduction activities. Next is financial. The spread of the pandemic has had a substantial socio-economic impact on people's lives throughout the world, putting tremendous strain on healthcare system. The COVID-19 pandemic's economic devastation and instability endanger the health and well-being of families across the country. In addition to significant job losses and reduced work hours, families with children confront difficulties as a result of school and childcare closure caused by the epidemic. I'll pass to next presenter.
Thank you for the second presenter. My name is NURUL Binti Muhammad ARIFFIN, metric number 1181707. Third would is affected of COVID-19 is worker. As we know, this pandemic has a significant influence not only on the health and education sector, but also on the economy. Job loss was one of the consequences they experienced due to shutdown economic activity to curb the spread of COVID-19. This is because some business were unable to resume operation due to a lack of income to pay employees' salaries, resulting in immediate layoff. However, the difficult conditions caused by the COVID-19 epidemic have resulted in a decrease in employment and an increase in unemployment. Second point is depression. COVID-19 transmission contribute to mental health issues in workers such as depression. This is due to the fact that working from home during the era of the movement control order has harmed their work-life balance. Depression affects not only those who have lost their employment but also those who have been required to work longer hours than usual. But employee issue can be overcome if employers grasp the principle of communication is key, which is employer need to be aware, communicate and understand the problem faced by each individual. Employees whose effects are not equal and cannot be beaten equally. As a nutshell, the employer responsibility at this time is described as the backbone supporting employees' health. We proceed to next presenter.
Thank you to Nurul Khairunisha. My name is HAFIZOH binti AHMAD and my metric number is 1182643. I will proceed to our first point, which is frontliner. My subtopic is high risk. The government employees most affected by the COVID-19 epidemic are frontliners workers. Who is frontliners? Frontliners is a health workers, which is including doctors, nurses, and also members of the police, army, fire department, and other civil defense departments, which is who have worked tirelessly to ensure the safety of the public and the security of the country during this epidemic, which has forced the country into lockdown for the past 2 years. Healthcare workers face the unsettling reality that they are routinely exposed to the potentially lethal cost of the crush and are at risk of spreading the virus to their own families and co-workers daily. Second point is fatigue and burnout. Frontliners are also suffer from physical and mental exhaustion. The COVID-19 pandemic has caused significant emotional stress among the country frontliners workers. Tan Sri Dr. Nur Hisham Abdullah, the Director General of Health in newspaper said a number of frontliners workers were showing signs of extreme stress or burnout when they are required to work with a commitment of more than 100% for an extended period of time. Then, the highest levels of personal burnout were found among pharmacists and healthcare workers in district health office. The maximum levels of work-related burnout were found among health inspectors and healthcare workers in medical laboratories, and the last maximum levels of patient-related burnout were found among paramedics and healthcare workers in private hospitals. This is all stated in burnout prevalence and its associated factors among Malaysian healthcare workers during COVID-19 pandemic and amended mixed method article. Next, I will pass to the next presenter.
Thank you to Hafizah binti Ahmad. My name is FITRAH binti Abdul Aziz and my matric number is 1182650. So I will proceed to our subtopic, which is pregnant women. And my first point is low immune system. As we know, pregnant women have a low immune system. This is because pregnant women are more likely to become very ill with COVID-19. For example, pregnancy weakness weakens the immune system. They are more susceptible to the flu and the common cold. For the pregnancy is considered to be the cause of the low immune status in some respects, as the maternal immunity is altered to be able to tolerate foreign cells, the fetus in the womb. And my second point is high risk. Pregnant women are at high risk. This is because pregnancy can expose women to several infections and illnesses for several reasons. This is because COVID-19 puts newly pregnant women at a higher risk of serious sickness. Several sicknesses may necessitate hospitalization, intensive care, or the use of ventilator to assist with breathing. And my third point is miscarriage. Pregnant women also may be face the miscarriage. This is because pregnancy puts women at a greater risk of getting any form of bacterial infection. Studies have shown that, for example, pneumonia or bacterial infection of the lungs can cause a high risk of complication to both the mother and the unborn baby. And my last point is give birth to a premature baby. Pregnant women will give birth to a premature baby. This is because positive pregnant women are also more likely to give birth before the 17th week of pregnancy. Pregnant women with COVID-19 are more likely to have a premature birth and cesarean delivery. So the baby is twice as likely to be born early and putting the baby at the danger of preterm. For the next, as you can see, this is our reference that we use in our topics, which is there are 19 references. That's all from us. Thank you for listening.
Thank you.